I'm Blake Putman. Thank you for the okay introduction. I'm gonna give you guys, Jim. Yeah, thank you. I'm a doctor, so my head barely fits in here. So, long story short, I got to introduce myself first. I'm Blake Putman. I'm a medical doctor here in town. I'm a family physician, board certified. I went to Central Michigan. I went to Saginaw Valley for my undergraduate. When you first give a presentation, a medical presentation, you're supposed to disclose any biases you have or whether or not you're getting paid by anybody. I'm not. I don't have any financial background as far as compensation from any company or anything like that, although I'm actively looking, so if anybody knows or if Lisa McLean can hook me up, please. I don't, Rinky, please, let's go. Long story short, I do have a bias, though. My bias is I'm unapologetically Christian. Quite honestly, there's literature out there. There's a lot of information, a lot of things to absorb when you're a physician in a small town. There's a lot of cultural things that you have to overcome. And quite frankly, when we talk about medicine as a whole, it can be incredibly consuming. When you mix politics into medicine, as we've recently learned from COVID, it can muddy the waters even further. And so I think a lot of times, unfortunately, what happens with our society today is very divisive. It's either you're black or white, and you're on one side of the aisle or the right or left. At the end of the day, I'm a Christian. I love Jesus Christ. I love people, and that's really why I got into medicine. Dad and my brothers have been very, very successful in business. And I'll tell you, it's a funny story, and I'll tell you later because it's a long story, but I told my dad one time that I wanted to go into medicine and become a doctor, and he threw me out of his office because his expectation was that I was going to join the family business. But medicine is a calling, and it's a calling because you got to really, really love people. And so when Billy asked me to give this topic and why this topic is so important and near and dear to my heart personally, it's because I truly do love people. And so when any person is hurt or injured or unfortunately becomes not the 100% of themselves, my heart just it crushes it. And so I think, unfortunately, in this political atmosphere, we start to say, well, if you don't believe the way I believe, I should demonize you or I should put you on a different platform, and I'm not here to do that for anybody. God forbid if you have a family member that had an abortion or you personally did or you know of somebody. I think that's the wrong way to go about it. I think what we should ultimately do is educate one another on our viewpoints. And so this talk, I'm going to try to set aside the bias that I have, which is that I'm unapologetically Christian. This is not to sway you to feel the way I feel. It's to educate you on why I believe the way that I believe and what the literature says from a medical standpoint in order to back up those beliefs. Unfortunately, again, when you're in medicine, you have to set aside your biases at times and say, okay, here's what I believe, this is what your health says, and this is what the outcome that we should have together. So this does a little bit of that, and I'm kind of a nerd, so I made a PowerPoint. Life, liberty, and the pursuit of happiness, obviously that's near and dear to a lot of our hearts because we live here in America. So what I wanted to start with, and sorry the lettering is a little bit small, but what I wanted to start with is one of the things when you become a physician is you talk about the Hippocratic Oath. So essentially this is, and there's a lot of history here, but long story short, it dates back to Greek times. Essentially it's been modernized, and this is a modern interpretation of one. I'll give you the whole thing later on in the presentation, but this is very significant. And in the oath that physicians take, it talks specifically about, I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body as well as the affirm. So the affirm, obviously, is people that are not physically and mentally have the capacity that a majority of us have in this room, not to be discriminated also by age. And that's very specific. If you Google infirm, please, I applaud you after this to Google it and understand specifically what that word means because it's very significant. So what we're going to do today is we're going to talk about a couple different key points. Obviously, abortion, everybody's heart starts racing when we talk about abortion, and it should not. At the end of the day, the reason why that majority of the time is because we feel like we're being attacked every time we say the word. It's a medical procedure, and it's out there, unfortunately, in my opinion. And I'm going to tell you why it's unfortunate, in my opinion, that it's out there. Because there are some very specific studies that have been done, and we're about to go through them. But in order to understand what it is, we have to talk about it. We have to talk about the numbers, and we have to digest specifically where to go from there. So in order to understand abortion, we have to understand what is a baby? What is a fetus? How do we define it? What is what size of a child, what size of a human being is this, right? So we're going to talk a little bit about what's called embryology, which is the development of really any human or any organism, and specifically we're going to obviously talk about humans, right? I'm not going to get in conception, right? That'll be a talk for later on. There's plenty of ways to do that, fertilization of an egg. You guys can, don't Google that. That's a red flag. We're going to talk a little bit about development, and then obviously the trimesters. Why trimesters are so significant, and again, this is a thing that in medicine is very confusing, is they talk about abortion by certain trimesters or certain number of weeks. If you really get down to the basics of embryology and studying human beings, obviously all females have what's called menses, or a period every month, okay? It's a 28-day cycle on average, okay? And so 2 weeks are the cycle moving through, you bleed, and then you move on to your next cycle, right? So majority of the time when we're talking about kids and the way they develop, you don't even really know that you're pregnant until you quote-unquote miss a period. Okay? Well, fertilization happens 2 weeks into your cycle. So what that means is by the time you figure out in beta-HCG, which is the chemical we say that you're pregnant, you're usually between 3 to 6 weeks already. You've already started off behind the 8 ball, so to speak, as far as, if you really wanted to, God forbid, get the kid at a young age or at fertilization. A majority of girls don't even know that they're pregnant until they're already 3 to 6 weeks along, okay? And so we divide it, obviously, in 3 trimesters. So every 13 weeks is a different trimester. First trimester, obviously, is the 1 through 13, 14 through 26, and then obviously 26 to 39, okay? So here's a little bit of overview about what a kid looks like and how they look as far as developmentally. Obviously, again, we start with fertilization. Use your imagination or Google, whatever. We're not going to discuss the specifics of that. Again, week 1 and 2. Again, that's after conception at say 2 weeks into your cycle. That's when the time clock starts. So as soon as the sperm meets the egg, here we are. About 1 to 2 weeks is where you see beta-HCG detectable. Now, again, what does that mean? That means that how many girls have missed a period in here? I'm 2 or 3 days late. I'm 4 or 5 days late, and then I take a pregnancy test. At that time, if you were pregnant, you're 3 weeks into your pregnancy already, 4 weeks into your pregnancy if you take it a week after you missed your period, right? And so at 3 to 5 weeks, we got a heartbeat. We got organ development. We got limbs. That baby that you see on the right there in that person's hand is 6 weeks old. That looks like a kid to me, right? If we go to 6 weeks, eyelids, eyes, nose, mouth, tongue, all are developed. Okay? 8 weeks, the baby's starting to move around. So when we talk about, this misnomer, in my opinion, of it's just a bundle of cells. You don't even know you're pregnant and it's got a heartbeat. I mean, we need to have real conversations about what that bundle of cells truly looks like, right? So fetal movement, obviously viability 1 to 13 weeks. So a majority of the time what happens, God forbid, if you have a miscarriage, is a genetic abnormality. Something didn't 100% align correctly. And so God forbid a girl or a woman will have a miscarriage. Now again, 98% of those are genetic anomalies, meaning the baby was probably never going to be viable anyways, okay? So with that being said, if we move on from there, we start to talk about the numbers of abortions. Now, again, I don't want anybody to have a palpitation or, God forbid, to have some sort of coronary in here, but this is real statistics. This is put out by the CDC. And again, I'm sorry the numbers are so small, but if you look at it, CDC data says since 2010, we've had, honestly, in my opinion, a great outcome, meaning we're starting to see a decline of abortion, and unfortunately in 2019 it kind of went back up. So roughly 750,000 babies, all the way to over 600,000. It's never dipped under 600,000. Holy cow. That's a lot. That is a lot of abortions. And this is the numbers in the United States. There's roughly about 1,700 providers in about 400 clinics, okay? And about 500 plus are in California. So almost a third are in one state as far as abortion providers. Okay? The WHO, which is the World Health Organization, says between 40 and 50 million worldwide. 40 to 50 million babies aborted worldwide. That's 125,000 a day. 125,000 kids are killed a day. Now, again, that's not a bundle of cells. In some countries, you have what's called a partial birth abortion. In some countries, you can do it in second trimester, third trimester. The United States is actually, unfortunately, one of the looser countries in the world that allows abortions for pretty much anything. You can choose gender, you can choose eye color, you can choose if the kid's got hair or not. You could say, well, I want one of my kids, I'm having twins, but I don't want the other one. That's all legal in the United States. I'm not going to get into the details of it. Again, you can go home and Google it. It's a traumatic situation. It'll make your stomach turn, and it's horrible. But this is kind of the procedure. Again, there's kids here. I'm not going to go into. So I put this in here for a very specific reason. You know, you mentioned that 125,000 kids a day worldwide that are aborted, right? Gun violence is obviously on the front page of every newspaper here recently because of, God forbid, the tragedy, and I'm saying utter tragedy that happened in Texas. Shouldn't have happened. Horrific situation. And now I hear a lot of people, left, right, and center, saying we need to save these children, save these children, save these children. Where are we when we're talking about the kids that are being aborted? Okay? And again, I'm a physician. I took that oath because I'm here to save people, man. I'm here, the default should be that we're here to protect each other. You know, God forbid something bad happens, why cannot the default be, I want to save the people? Why is that the default in every other situation? God forbid an 18-year-old young man wants to harm himself. When he's rushed into the emergency department, what happens? We save him. Well, wait a second, he just made a choice on his life. So why is his choice not significant there? But if we want to abort a kid, the woman has the right to choose. Why cannot the default be we save the life? I need this line to be better defined because ultimately we're making decisions for kids that can't talk. They don't have a voice. They don't have an opportunity to say, I'm in here. And we're not talking about a bundle of cells. That's also a little frustrating, guys. Before we even really know that we're pregnant, we got a heartbeat. We got eyes and limbs developed, okay? So if you look at the numbers of gun violence, as of 2020, roughly just over 45,000 total deaths of gun violence. 45,000, just over, 45,222 gun-related deaths in the United States. 54% were self-injury, meaning people harmed themselves, suicide. So now we're talking about 19,000, which was the most in U.S. history. 1993 was the second highest, which is 18,000 murders. So all the other gun deaths related to, so 19,000 people, again, it's front page of every single newspaper, Fox, CNN, MSNBC, we need gun reform for 20,000 people in comparison to 600,000. So my point is we got 20,000 over here, we got 600,000 over here. Where's the voice for these kids? I'm screaming from the rooftops. Where's the voice for these kids? If we want kids to be safe, why don't we protect the 600,000 first? Because 19,000, that's not all children. And we can go down into the specifics of the masses. And again, I'm not saying that that's okay. What I'm saying is if we're going to look at the big chunk of things and fix the things that are most concerning first, in my opinion, it needs to be abortion. Nobody else dies of more things in our country than the abortion. Guess what? Secondhand smoke in 2015. Secondhand smoke, which means that if your parent or your uncle that lives in your house smokes, that was attributed to 41,000 deaths in 2015. Twice the amount of people that were murdered from guns last year. Come on, guys. Help me define the line. Help me to understand. So, Again, I apologize about the small print. I thought we had this big giant projector, and in my mind it was a lot of great. But there's two things in this Hippocratic Oath that are very significant here. So I'm going to read this to you. I will respect, now Hippocratic Oath, I'm going to get into why this is so passionate for me. I will respect the privacy for my patients, for their problems are not disclosed to me that the world may know. Most especially must I tread with care in matters of life and death. If it is given me to save a life, all thanks. But it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play God. I must not play God. Every single physician took that oath at some point. And again, I'm not trying to point any fingers here. That's not my job. But I know a lot of physicians that go to church. When's the last time you heard them giving a talk about abortion? When's the last time they said, hey, I'm in love with Jesus Christ at their clinic? I left being an employed physician to go independent because I was tired of trying to bounce around in the visits to HR. I'm telling you, holy cow. Human resources has changed even since I've been a physician, I'll tell you. Here's another significant thing in this oath. I will prevent disease whenever I can, for prevention is preferred to cure. Now, why is that significant? You're going to see it very significant. That prevention is preferable to cure, right? So, if we go into who's affected by abortion, obviously moms are affected. You're about to see that. And future mothers, children and future children. Fetal death, I mean, that's very significant, right? And then nobody ever talks about dads. Nobody ever talks about what happened to the dad that wanted the kid.
Absolutely.
Nobody ever says, what happened to his mental health? Yeah. How is he struggling with this decision that was seemingly completely out of his control? Why all of a sudden now do we ostracize a certain gender? Again, I'm from a medical standpoint. This isn't I'm not trying to, Billy's good at politics. My dad's great at politics. Brian's a great builder. That was a joke. My point is I'm a physician. I'm here for male and female. At the end of the day, I want to make sure that the mental health of the female is just as significant as the mental health of the male. Where's that discussion, right? So if we dive into the numbers, now this is where I get a little bit nerdy, because I like to read, and it's kind of annoying. I'll be up at 2 a.m. and my wife's like, shut the light off, I need to sleep or whatever. But I'm reading studies. Now, they did a couple different studies. So they talked about this obviously affects, and a majority of people know this, it affects more minorities than in the lower people of socioeconomic status. Look no further than Hillary Clinton's mentor, right, who started Planned Parenthood, right? So in 2008, the abortion rate for non-Hispanic white females, so Caucasian individuals, 12 per 1,000. Almost 3 times were Hispanic females. Okay? I put Blake, that should be black women. Not Blake women, black women. That's an autocorrect. Megan probably put that in there. It should be black women. So 40 per 1,000. So almost 4 times the number of black females. Where's BLM? Again, I'm trying not to be political, but again, if we're going to really affect the children in our youth, you saw the numbers more than I did. Almost 4 times the amount of abortions are from black females. And then we talk about, and this is a little nerdy, but the federal poverty level. 52 out of 1,000. If you're over 200% for the federal poverty level, 9. Almost over 5 times, right? Mothers. So again, this is super nerdy, so sorry, but risk of breast cancer. This is very significant. You know, there's a lot of discussions about moms and maternal health and these kind of discussions. Risk of breast cancer among women. Relationship to induced abortion. So this is the study, okay? I don't know how to pronounce that guy's name, but I'll give you the paper after we're out if you're interested. Among women who had been pregnant at least once, the risk of breast cancer in those who had an induced abortion was 50% higher than the amount of other women by the age 45. So 50% higher risk of breast cancer before the age of 45 if you have an abortion. One abortion. Anybody ever heard that?
Yes, I have.
Why? Why have we not heard that? Is significant. We wear these pins with the purple pins, right? The ribbons. We do marches. Shouldn't that be on the forefront of that discussion? Hey, you have a 50% increased risk of breast cancer if you have one abortion. One abortion. Okay? Teenagers under the age of 18 and over the age of 29. Under 18, over 29. 100% higher risk of breast cancer before the age of 45.
Blake, where'd you get this? Is this CDC?
I'll give it to you. This is very common knowledge to the medical community.
We haven't heard.
That's a political.
Our women are in danger.
You are in danger. And this is just the tip of the iceberg. Let me get into it. It's going to get even worse. Teenagers with a family history of breast cancer, they don't know the number. It's incalculable because every single person in the study got cancer before the age of 45. If you have a family history of breast cancer, everybody in the study before the age of 45 had breast cancer.
I read an article on it.
Is that not amazing? And how is that, if we're going to talk about...
What's amazing is our government is intelligent.
Won't even have a discussion. This is why it occurs. There's 4 different types of lobules that occur in the breast. During pregnancy, the 3rd and the 4th resist breast cancer. Those are developed breast lobules that help produce milk, okay? The 1st and the 2nd are developmental lobules. 2nd are what you get after you mature. 3rd and 4th are what you get during pregnancy. If you interrupt before 32 weeks, so if you interrupt about a quarter of the way into that 3rd trimester, okay, that's where the issue lies. And that's, again, this is very common medical literature, very easy to discuss. The longer a woman maintains type 1 or type 2 breast lobules, the higher risk of breast cancer. And that's why that you have a 50% increase, 100% increase, and if you have a family history, incalculable. Okay?
Does the insurance pay for...
We're going to get to that. See, he loves to jump. He's a jumper. We're going to get to that. And why politics is played into abortion at this time and why it's so significant and what they did in South Dakota was so huge. So, mental health. This is from the British Journal of Psychiatry. Okay? These are numbers that are, again, I'll give you the literature, I'll give you the studies, and you can dive through them as well. Anxiety, 34% higher. Depression, 37% higher for women that have abortion. The study was they compared women that delivered versus women that had an abortion and compared them side by side. Same number of people. They said anxiety went up 34% for people that had abortion, 37% for depression, alcohol 110% higher, suicidal behavior 155%, 155%, marijuana and illicit drug use 220% higher if you have an abortion. Study reviewed right around 9,200 women, ages 15 to 49. Risk of suicide after birth was half that the general population, which means that if you give birth, you're half as likely to commit suicide. If you give birth and have a child, you're half as likely to have to commit suicide. Following an abortion, 600% higher. Side-by-side comparison, 9,200 people. Okay? You know what the dates were of the suicide? That was a secondary study. The date was around the time of the abortion, so not about the trauma that they had. God forbid if it was incest or rape or whatever. Not about the trauma. Around the time of the abortion, anniversary, and what the child's expected due date was.
Yes, the child's birthday.
So we talk about rape and incest, right? Those are the two major, and we're going to talk about the numbers of those. But we talk about rape, but the people weren't talking about the trauma they had. They were talking about the baby that they lost. I'm not here to demonize anybody, guys. I'm not here to say that they're bad people. I'm here to say that we need to do something. We need to do something drastic. We have 19,000 murders in the United States, and we're talking about billions of dollars that are going to be spent in order to help with mental health. What about these women? That's what I'm screaming about.
Here, here.
That's what I'm screaming about. And again, I haven't even spoken about the men. You know, there's next to no, in medicine you're never supposed to say never, and you're never supposed to say always. So I don't want to, there's next to no literature about mental health in men whose girlfriends or wives have had abortion. Not even discussed. Not even discussed. Okay? So
They don't come into the equation because they're not the ones carrying.
it's a sad fact.
Here, bud.
Recent study in Ireland and Great Britain, 2012. Okay? 40 plus years of legislation in relation to abortion. So all that 40 plus years they did a data collection. Okay? Higher rates of stillbirths, 27% higher. Low birth weights and premature birth weights, 30%. If you have one abortion, this is what's called the dose effect. The more that you have, the worse it becomes. It's called dose effect.
Why is that?
We'll go into that in just a second. Increase by 30% if you have one abortion, 93% if you have two or more. So you'll have a smaller, so this is how it affects women down the road as well. You have one abortion, you have a 30% higher risk, 1 in 3 of your next future kids will either be low birth weight or premature. 93% likely if you have more than 2 abortions. So women will say, well, I had God forbid I made a mistake and I'm going to have an abortion. And then I'm going to have another one. They're affecting their kids in the future. Because that kid, that small little infant baby, okay, what happens when that low birth weight or premature kid comes out? Risk of cerebral palsy goes through the roof.
But they're allowed to make that decision as a teenager without their parents' consent.
Did you read these slides, Dan?
I read.
So there's another study here. It has been claimed. Yeah, right. It is. He pulls them off my nightstand. It has been claimed that induced abortion is directly responsible to many thousands of cases of cerebral palsy in North America alone, that otherwise would not have occurred. Supporting this assertion is that the fact that the cerebral palsy risk in extreme preterm is about 38 times higher than the overall population of newborns. They said that if you have a premature kid, you're 38 times more likely for it to be cerebral palsy. Maternal deaths before and after procedure. Okay? So these are obviously common discussions that we have about arguments in favor and or opposed to abortion. We talk about saving the mother, lose the child. We talk about right to choose. We talk about rape and incest. And we talk about mental handicap or retardation, right? So there was a study done in Mexico. Mexico City allowed abortions, and then they compared that to the rest of the 31 states in Mexico. There was no maternal death rates, did not decrease because of abortion. One of the common arguments is, well, if we don't have abortion, then these women will just be dropping dead on the streets because they're going to produce them themselves, or they're going to perform them at home, and they're going to bleed out, and God forbid, there's going to be, all these women are going to be, unfortunately, not taken care of. Mexico proved that that's not true. The death rates for the moms did not change because the city allowed abortions. Oxford, University Press on behalf of the European Public Health Association. When age is controlled, meaning if you have everybody the same age, 6 times greater risk of death among women who had never been pregnant. So if you never have any kids, you're 6 times more likely to be at risk of death. Again, here's that dose effect. So one of these outcomes, modest to increased risk of death, whereas 2 outcomes resulted in moderately high risk. Further, with 3 or more abortions, nearly 2 times greater risk of death to the mom. Also significant, decreased mortality risk associated with birth. 2 or 3 or even 4 more births. So the more kids you have, the less likely you are to commit suicide or harm yourself or die. The more abortions that you have, the more likely you are to pass away. The mortality rate goes through the roof. 2 times higher of all-cause mortality.
I have a question.
Yeah. Mike, let me just finish and then I'll answer all questions. So write it down on your paper real quick. So one of the common arguments is what about save the life of the mom in order to, save the life of the mom versus save the life of the baby? What if that conundrum, that ethical, I have never met an OB. I can deliver anybody that's pregnant in here. I can deliver you today if you want. I have privileges to do that, okay? Never met anybody that could tell me the ICD-10 code or the specific diagnosis that would say, we need to murder this kid or mom's going to die. Doesn't exist. There are diagnoses out there that say that we need to deliver babies in order to protect mom from seizure disorder and other things. There's no diagnosis that says that the baby needs to die in order for mom to survive. There are a lot of times that we do deliver kids early. This is one of them. It's called eclampsia and preeclampsia. Risk of seizure. Guess what? When does it happen? Late second into 3rd trimester. Guess when babies are viable, meaning they can be delivered? At 20 weeks, which is when? In the middle of the 2nd trimester. Why are we killing these kids? It isn't to save mom, because guess what? There's also a cure and a treatment. You give them magnesium and you hydrate them. And then if that doesn't work, you deliver them. Tell me the medical diagnosis that says that we need to kill the kid in order to save the mom.
Tubal pregnancy?
Tubal pregnancy isn't a viable baby. Ectopic pregnancy, that's not a viable child. Those babies cannot function. That's your first trimester miscarriage. Those are all in the first 13 weeks. So you have to remove those.
Passed away anyway.
Yeah, they're not viable children.
Okay.
The viability like that, in that they're not in the right spot, so they're not going to get the nutrients anyway. So you have to remove them in order. Those kids aren't going to exist.
So what you're talking about is actual viable.
Yeah, children. Yeah. So we talk about other forms of non-consent leading to pregnancy. So Dad mentioned something about consent with regard to children, and this. I don't know if you guys have ever heard of this. It's a very common abortion topic. It's called the Hyde Agreement or Amendment. Okay. Essentially, what they did in the I think it was 1980, is they said that we don't want the government to federally fund abortions. Up until that point, they calculated roughly 300,000 kids annually were federally funded abortions. 300,000 where the government was aborting those kids. Okay? So they made an amendment. There's a congressman, it was Mr. Hyde, Henry Hyde, okay? And they said there's going to be 3 exemptions. Save the life of the mom, what we just talked about, rape, and incest. If they're rape, incest, or save the life of the mom, we can have federal funds. So the state said, and why South Dakota is so significant, the state said, we're also going to step in. And right now, as of 2021, 16 states through Medicaid will help women with abortions. That's where politics comes in. That's where medicine stands aside and says, you know, this is personal. It's a thing that I'm told by my advisors financially not to do, but I take everybody's insurance. I don't care what kind of insurance. I think it's absolutely disgusting for physicians to say, I'm going to take a certain number of these patients that can afford this. I'm going to take all these because this is great insurance. I think that's absolutely atrocious, and I think it nullifies and it discriminates against the greatest among us and the least off among us. Okay.
Will you take the patient if he doesn't even or she doesn't even have?
If you don't have insurance and you can't pay, I will take you.
Thank you.
Okay. So my point with this is if certain individuals will take certain insurances because the kickback and the reimbursement is better. Again, I went independent to avoid that.
Should be illegal.
Okay, and it should, in my opinion, be illegal. That's where the government should step in. When you go to an abortion clinic and you say that I have rape or incest or my life is threatened, guess what? The government will pay for it. It's a sad fact. That means everyone in this room is paid for an abortion, unfortunately.
Do they even investigate it? Do they have to prove it?
Nope. Here's the significant part. 1% of women having an abortion report surviving rape. 0.5, less than 0.5 are incest. Now, here, this is not, listen, incest is among us. It's among us, okay? Why do we separate rape and incest? If you're assuming that rape is incest, why is it not categorized together? Why don't we just say rape? There are a lot of individuals in the United States that marry their cousins. Technically, that's incest. Why is it categorized in abortion?
Money.
What is the significance of that? It's not medical.
The genes, something bad in the genes.
Well, there's absolutely reasons not to have intercourse with your cousins, but so informed consent. This is why this is significant, because at the end of the day, if you go back to that hypocritical oath, anybody in here that's had a procedure, any procedure, whether you delivered a kid, whether you had a knee procedure, whether you had a hip replacement, whether you had a knee injection, whether you had something in the office taken off your skin, had to sign likely something. You go into the hospital and get your blood drawn. It's called informed consent, okay? Which means specifically, informed consent is the process in which a healthcare provider educates a patient about the risks, benefits, and alternatives of a given procedure or intervention. If we told our women that your risk of suicide, your risk of anxiety, depression, illicit drug use, breast cancer, all these different things, if we really sat down and told our women that all these, we can sit here and debate the numbers and we can talk about this study versus this study, but we know that those go up. The numbers specifically, we can sit here and have a conversation, but you will have an increased risk of anxiety, depression, risk of alcoholism, risk of illicit drug use, risk of suicide, and risk of breast cancer. Just the women. If you told them that informed consent, how many of those women truly would be able to sign that paper? And if we had a procedure in the United States that said, hey, if you get a knee replacement, your risk of suicide, depression, anxiety, illicit drug use, breast cancer, et cetera, there is not a physician in this country that would perform that procedure. The medical liability would be so astronomical, but because it's so politicized, and because we have not people looking out for the best interests of your mental and physical health, and for sake of argument, spiritual health, okay? I don't believe this is true informed consent, me personally. I don't believe it. And again, why cannot the default be we save the life? Why is that not the default?
Like when women go in for one, they don't let them see the ultrasound either.
Yeah, and that's maybe a point for access to care. You know, at the end of the day, why are we only seeing certain insurances, not seeing certain insurances? You know, at the end of the day, why isn't an ultrasound $1,200 or $700 at the? It's an ultrasound. I mean, the machine's already paid for. They own the machine. Choroid plexus cyst. Choroid plexus cyst. One of the third things is mental retardation, right? Mentally handicapped. We abort kids that are mentally handicapped. This is what's called the choroid plexus cyst. It's a very specific thing that's seen in what's called trisomy 13, which is, God forbid, it's a mental handicap. Yeah, sure. This is, see, and an ultrasound, black means it's either a fluid or really clear. The whiter it is, the denser the material. So bone is white. Who said white? Mercy? You, Emma? Emma. So white, this is the skull of an infant. This is, when you're looking at an ultrasound, so it's cut in half, so to speak. So this is brain material. This is a cyst, this is a cyst, that's a cyst. This is what's called a choroid plexus cyst. This is found very commonly in what's called trisomy 13, which is a form of mental handicap, and usually the baby survives right around 7 to 8 hours after birth, okay? Mercy, will you stand up? This is her ultrasound.
Mercy.
4.0.
Just a second, Blake. Mercy. How many A minuses have you gotten in school since you started?
None.
Are you a straight A student?
Yeah.
4.0 in
Did you
school.
just win the state of Michigan's Student of the Year award for going from kindergarten to 8th grade with straight A's?
Yeah.
Thank you.
This is my oldest daughter. It's my oldest daughter. This is her ultrasound when she was right around 20 weeks. And you know, obviously when you get this, it's like first child, and it's like this. It's supposed to be this fun and unbelievable experience between me and my wife. And we were 19 years old until we turned 20. We were married. Okay, don't get weird. We saw this, and wow. I will tell you very specifically, again, at 19 years old, holy cow. And so I see this in our OB, again, I'm not trying to cause any, throw any dispersions on anybody, but he's supposed to be this Christian OB, and I felt like there was this dull, humid, thick cloud in the room of a discussion that we were supposed to have. Okay, and we left that, and I'll tell you, it's like it was yesterday, and I had the support of a dad, a mom, two older brothers, two sisters that I see as my sisters. The support is unbelievable to kind of say, guys, we got you. We're here for you. We love you. This isn't going to slow us down. This isn't going to be a big deal at all. Okay. What about the women and the children and the parents and the men that don't have that support when they are stuck with the decision because an OB thinks of himself more highly than he ought? We are human beings, and we should not do what? Play God. We should be here for each other, and we should celebrate life. And if we can't celebrate life, why are we here? For the life of me, I cannot understand why we cannot come together as a nation and say, the default is we're going to support these women and their mental health and their substance abuse and all the other things that could potentially go wrong for less than 1.5% of the people that we're for some reason keeping the 600,000 kids alive, or we should be, right? 600,000 kids are being aborted for 1.5% of them? Come on, guys. Again, and I hate to be this passionate, and I'm sorry, but at the end of the day, this is my bias. This is my bias. If I'm going to disclose to you really how I feel, I'm a Christ follower. And this is what the literature in my book, my true book, says. This is about preserving life. This is what God says that we should do. And if you believe in that, God bless you, and that's my favorite topic, if you're honest. I talk about God until I'm blue in the face and the sun comes up and up and up, and we both pass out. If you really want to see what I'm passionate about, let's talk about Christ. But at the end of the day, if we can't come together and say, I'm going to preserve the next generation that is sitting right there, what can we agree on? What can we agree on? So, I'm Blake Putman. Thank you for listening to me or letting me bark at you. That's the end of my slide. I'd be happy to take any questions.